Bismillah ar-Rahman ar-Rahim. In this video we will talk about 5 diseases. The first disease is polyarteritis nodosa. Is a systemic vasculitis characterized by necrotizing inflammatory lesions that affect medium-sized and small muscular arteries. These lesions result in microaneurysms formation, aneurysmal rupture with hemorrhage, thrombosis, and organ schema or infraction. Primary cause of ban are idiopathic. Secondary ban is less frequent and often seen in hepatitis B and hepatitis C and leukemia. Pathophysiology is characterized by segmental transmolar necrotizing inflammation of muscular arteries, most commonly at point of bifurcation. Unlike other vasculitis disorders, doesn't involve post-capillary vein lungs or veins. Lesions in this stage of development and healing are usually present. Early lesion contain polymorphonuclear leukocytes and essentially eosinophils. Later lesions contain lymphocyte and plasma cell. Granulomatous inflammation doesn't occur. Intimal proliferation with secondary thrombosis and occlusion leads to organ and tissue infraction. Weakening of the muscular arterial wall may cause small aneurysms, and arterial dissection healing can result in nodular fibrosis of the adventitia. Most commonly affected are the kidneys, skin, peripheral nerves, joints, muscles, and gastrointestinal tract. Often affected are the liver and the heart. Renal ischemia and infraction occur. The second disease, giant cell arteritis, is an inflammation of the lining of your arteries. Most often it affects the arteries on your head, especially those in your temples. For this reason, giant cell arteritis is sometimes called temples arteritis and is affecting the large blood vessels of scalp. Neck and arms inflammation causes a narrowing or blockage of the blood vessels, which interrupt blood flow. In this disease, we have risk factor age. First one affect adult only, and rarely those that under 50. Sex women are about 2 times more likely to develop the condition than men. Pathophysiology. The pathological mechanism is the result of an inflammatory cascade. This is triggered and by an azovate determined cause resulting in contracted cell in this mesal wall. Recruiting T cell and macrophage deforming granulomatous infiltrates. These infiltrates erode the middle and inner layers of the arterial tunica media, leading to conditions such as aneurysms and dissection. Activation of T helper 17 cells involved with interleukin 6, interleukin 17, 21, 23 play a critical part. Especially T helper 17 activation leads to further activation of T helper 17 through interleukin 6 in a continuous cyclic fashion. This pathway is suppressed with glucocorticoid, and more recently it has been found that interleukin 6 inhibitors also play a suppressive role. The third disease is Takayasu disease. Is Paracelsus disease is a granulomatous arthritis that predominantly affect the aorta and the great vessels. Unlike GCA, Takayasu is more common in young women and is highly prevalent in Asian population. Pathophysiology of Takayasu. Takayasu, however, rumen narrowing of the aortic and its branches are common. Rumen narrowing is due to a number of mechanisms. Firstly, infiltration of cell leading to inflammation and destruction to the vessel layer. 2. Thrombosis and fibrin as the mechanism of repair. 3. Hyperplasia fibrosis of thickening of the arterial walls as result of the inflammation. The fourth disease is Wegener syndrome. Wegener is a rare disease of uncertain cause that can affect people of all the ages. It's characterized by inflammation in various tissues including blood vessels, but primarily part of the respiratory tract and with kidney. As we mentioned, the cause is unknown. Pathogenesis of this disease is a granulomous form with histiocytic epithelioid cells and often with giant cells, plasma cells, lymphocyte, erythrophil, and eosinophil are present. Inflammation affects tissues as well as vessels. The vasculitis may be a small or large component of the disease. Micronecrosis, usually with neutrophils, occurs early. Micronecrosis progresses to macronecrosis. A central area of necrosis is remained by lymphocytes, plasma cells, macrophage, and giant cells. A zone of fibroblastic proliferation with parashedding and histiocyte may surround the area. Our last disease is Kawasaki. Kawasaki disease is vasculitis of medium-sized arteries, most significantly the coronary arteries, which are involved in about 20% of untreated patients. Tend to occur in infants and children between 1 to 8. It's characterized by prolonged fever. The cause is unknown, but risk factor is under 5 years old, boys more than girls. Pathogens of Kawasaki disease. The inflammation in Kawasaki disease involves the small and medium-sized coronary arteries. Involvement is the critical factor that determines morbidity and mortality. Investigators purpose that mediators such as tumor necrosis factor, interleukin, interferon, and interleukin 6 produces by activated T cells and macrophage. Promote vascular injury. The earliest pathological change report in the vessel wall is a subendothelial accumulation of T cells, mononuclear cells, macrophage, and monocytes.